Good evening and a very happy new year to you. I'm Shelley Hill. When will this pandemic end? Is a question we've heard with increasing frequency this year. In the final weeks of 2020, it seems the world is closer to getting an answer as vaccines have started to slowly roll out across the world, offering hope for an end to a pandemic that has devastated lives and livelihoods worldwide, including Jamaica. Now, the COVID-19 outbreak is one of many events that have made 2020 a year like no other. From the ensuing public health crisis and its toll on diverse communities, impact on businesses and schools, to the increasing urgency of curfews and travel bans, to name just a few. The year has brought more changes than many could have imagined. But in a year of unprecedented change, we also feel hopeful, having seen time and time again the power of people to help each other through this crisis, sometimes against all odds. Now, as 2020 comes to a close, we share this look at some of the year's milestones and what we're looking forward to in 2021. On March 10, Jamaica recorded the island's first COVID-19 case. Here is our report on that story.
The first case of the COVID-19 coronavirus in Jamaica has been reported by Minister of Health and Wellness Dr. Christopher Tufton. A female who arrived on the island from the United Kingdom on Wednesday, March 4, has been placed in isolation after testing positive for the virus. Here's more from today's press briefing with the Minister, Dr. Tufton.
She arrived in the island on March 4th, presented to the public health system on March 9th, and has been in isolation since then. Based on the patient's travel history and symptoms, health professionals suspected COVID-19 when she presented herself. A clinical sample was collected and sent to the National Influenza Center, where lab tests confirmed the diagnosis today at approximately 11 a.m. The patient and family members have been informed of the development. The patient's infection was travel-related based on the assessment. However, steps are being taken to prevent the risk of community spread.
Dr. Tufton stated that measures have been put in place to prevent community spread of the COVID-19 coronavirus and that travel restrictions have been expanded.
These measures include the dispatch of a health team to the home of the patient for assessment and initiation of public health measures, the identification and contact tracing for all possible exposed persons, meeting of ministry officials with members of staff at the hospital, and the necessary interventions that are required to be put in place. In addition, imposed travel restrictions remain in place. In fact, 3 countries have been added to the list of the 5 that were originally announced. China, Italy, South Korea, Singapore, and Iran are the original countries. That was previously made public. We have added to that Spain, France, and Germany. The Ministry of Foreign Affairs and Foreign Trade and I met this morning with the ambassadors of those countries as well as the EU ambassador, and have informed them that based on the risk assessment of community spread of the virus in those countries, that travel restrictions would be imposed.
The health minister went on to urge the public to safeguard themselves against the illness, which has affected over 110,000 persons worldwide.
As part of the overall strategy that was put in effect some time ago, I would like to advise the public to continue to observe and perhaps strengthen their sensitivities to public gatherings, which we are discouraging, non-essential travel. We continue to patrol irregular border crossings. Sensitization of key personnel at all air and seaports will continue. We have designated 4 quarantine facilities and others will be identified, and those are being used or being prepared to be used. And we are finalizing the retrofitting of isolation facilities in each of the island's public hospitals. On the readiness of the island's health system, the ministry has developed the local capacity to test for the virus, which we did, which has led to the confirmation of this particular case, thanks to training support and material support from the Pan American Health Organization. Assess the readiness of our health facilities to meet the anticipated increase in demand on services. Continue to address existing gaps, including with respect of additional supplies and equipment through, at the present time, we have enough personal protective equipment in the island for our health facilities. We also have adequate stores of respiratory medicine for the next 3 months with additional supplies on demand.
We'll bring you more updates on the coronavirus in subsequent newscasts. Reporting for Mello TV News, I'm Brianna Chambers.
Now, following the Ministry of Health and Wellness's announcement of the first confirmed case on the island, Prime Minister Andrew Holness says the government of Jamaica is prepared to deal with the occurrence of the novel coronavirus COVID-19 on the island, and gives the country his assurance that verified information will be provided in a timely manner on all pertinent matters relating to COVID-19.
I give you my assurance that the government will provide accurate and verified information in a timely manner on all pertinent matters relating to COVID-19. To this end, I have established a protocol to advise the leader of the opposition directly of any development, and will convene an ad hoc bipartisan parliamentary committee to ensure information sharing at the political level. The government will continue to monitor and manage the situation on an hourly basis and make decisions for the public health and safety as necessary, as we have been doing for the past few weeks. For instance, the government has assessed the global situation and has updated our travel restrictions list to include France, Germany, and Spain. We have strongly advised our schools that normally send athletes to the pen relays not to do so. I have advised through the Cabinet Secretary all governmental officials, including ministers, not to undertake non-essential travel. We are analyzing the potential contagion impact of some large public events, and as the situation evolves, we will make appropriate decisions in favor of the health of the public. As it relates to schools, we have made financial provisions, recently announced by Minister Samuda, for schools to acquire hand sanitization products, as schools will continue to be open unless the government of Jamaica directs otherwise. So go about your normal business. However, pay close attention to the advisories and information provided by the government. Increase the awareness of your own health and the health of those around you. Until a vaccine is found, the greatest means of control is smart and informed human behavior. Panic and spreading false information are not smart behaviors. Every Jamaican must take personal responsibility for their health, hygiene, and travel.
On March 18, sadly, Jamaica recorded its first death related to the coronavirus disease 2019, COVID-19. The deceased was a 79-year-old man from Clarendon with a travel history from New York. At this point, 15 persons have tested positive for the virus, and the Bull Bay community is under a quarantine. Here is a look at that story.
Us in what we hope to be a constant engagement with you as our principal communicators to the national environment around COVID-19. In the last 24 hours, the National Influenza Center has made available the results that we were tracking from yesterday, 11 test results. Of the 11 test results, 2 positive were identified for COVID-19, and the remaining 9 were negative. It is on a sad note that we announce our first death from COVID-19. The patient tested positive today and died today. Jamaica now has a total of 15 confirmed COVID-19 persons. Today, we are awaiting the results of 6 tests, which are now at the National Influenza Center. One of the positive cases that were tested in the 11 is linked to the first patient, patient 1, while the second is our new patient with a travel history from New York. Of note, 458 persons have come into the island from a country of interest since January 31. 25 persons are now in government facilities for quarantine. 91 are in home quarantine, but note that this number does not include those persons who are in community quarantine in 7 and 8 Miles Bull Bay. And 28 persons are currently in isolation in government facilities, hospitals that is.
The concern from some members are that they need some more personalized attention as it relates to food supplies and medication. I can appreciate that some persons may have that concern. The truth is that when the quarantine announcement was made in the early stages, persons would have had, under normal circumstances, supplies for the next day or a day or two. Over time, however, it is quite understandable why some persons would run out of food supplies. And as a consequence, more effort or more support would be required. Remember now, to the extent that they observe the quarantine is the extent to which they can't leave the community or should not leave the community. And frankly speaking, the socioeconomic profile of the community suggests that many of those persons' disposable income would not allow them to stock up for a month or 2 weeks of supplies. So it's very understandable why some persons, even if they are not indigent, which would have been our first focus, over time would require support. I think the Ministry of Labour and Social Security have been doing a lot. They have been delivering quite a number of food packages. I've seen the packages for myself. I think it's quite substantial. We, however, took the decision that we would increase the number of packages that would be delivered to the community. So we would now make more available. And I visited the warehouse where the packing was taking place or is taking place. And we co-opted and got the support of the private sector to donate a fair bit of additional supplies, which will start rolling out, if not already, tomorrow.
And I've spoken to the team. They have reassured me that they have gone to every location, but what they have been doing to date is dealing with persons that are deemed indigent. And that's the point I'm making. Where persons are earning and can afford, as they have been in their normal course of activity, to buy their own goods, those were left because the priority was on the indigent. The point I'm making is many of these persons earn on a day-by-day basis. So if you quarantine them for 14 days, you're going to have people not having enough, having used up all their stocks and all their disposable income. We now have to step into that, and we are doing that. That's the plan. So the PSOJ, for example, have come on board, and we've gotten some contribution in terms of food kind. We're working with some of the NGOs, Food for the Poor and others, and the Ministry of Labour and Social Security. And there's a packaging center now that's set up and running, and we're going to be ramping up the volumes of packages. I think you saw the packages around there. They're fairly decent packages in terms of what they have. We're going to have to give out more to deal with those persons who can earn but have not been able to earn because of the quarantine arrangement.
The government closed the borders to all incoming travel on March 21 as part of measures put in place to slow the spread of the deadly coronavirus COVID-19 pandemic on the island.
With effect from 11:59 p.m. on Saturday, that is Saturday coming, March 21, 2020, and for a period of 14 days, that is for the next 14 days from the 21st, Jamaica's air and seaports will be closed to incoming passenger traffic. I think that's very clear. Outgoing passenger and cargo will be allowed. So cargo coming in, cargo going out will be allowed. Outgoing passenger definitely will be allowed. There have been many questions asked about the operations of our airport as to whether or not we have equipment for taking temperatures and the level of security that is at the airport, particularly with incidents that have happened. Just again, by way of update, in both international airports, Norman Manley and Sangster International Airport, we have some very sophisticated temperature equipment, scanners. You don't see them. No, not the handheld ones. You may not readily recognize them, but they are strategically positioned and they do thermal imaging. They capture you as you walk through and they raise alarm internally for the agents who are at the airport to pull you out of the crowd or stop you if such alarm is raised.
Now, following the closure of the ports, 75 crew members from one passenger line cruise ship were left stranded overseas. However, on May 6, 115 Jamaicans who were stranded overseas arrived on the island on a chartered flight from the United Kingdom, UK. This included the crew members, while 40 others were stranded in the UK for various other reasons.
Great one. Like we're at sea like for almost 70 days now. I mean, like we were close to coming home when we were in port. I think I don't remember when, but
April 2.
April, yeah. From that time, yeah.
It's a warming pleasure, man, to be home. Nice to be home. That's what I said. It's a pleasure. It's a very warm feeling to be home, and that is what is most important for me at the moment. What I'm minding now is just normally what is best for me. That is what most important. So if I have to quarantine, that's what it has to be.
Prime Minister Andrew Holness made an announcement at one of the many COVID-19 press briefings that we would see during 2020 that the borders were to be reopened to repatriate nationals on June 1 and reopened for all international travel on June 15.
During the period June 1 to June 14, all persons seeking to re-enter Jamaica will be subject to testing except for those entering from a country within the travel bubble as defined on which we will give the specific criteria of those countries we consider to be within our bubble. And for clarity, Jamaicans returning from countries not considered to be within our travel bubble would be required to be tested and quarantined at home with either phone or wristband geofencing. As of June 15, non-Jamaican nationals will be allowed to enter Jamaica. Protocols regarding this have been established and further details will be provided in due course. As of June 15, testing on arrival will be subject to the result of the public health screening at the port of entry. All persons entering Jamaica, however, will be encouraged to undergo voluntary testing at the port of entry, or they can make an appointment on the Jam COVID app to be tested. As we increase the rate of repatriation of Jamaicans and then move to allow non-nationals effective June 15 to visit Jamaica, we recognize that even with the best will and the most faithful implementation of measures, there is likely to be an increase in our confirmed cases. We must use our available resources in a targeted way to manage and mitigate the risk. We do not have the resources to entirely eliminate the risk. Like most countries globally, our economy has suffered a severe setback as a result of the pandemic. The Planning Institute of Jamaica recently reported a large decline of 1.7% in real GDP for quarter ended March 2020, and has projected a decline of 12 to 14% for the April to June quarter, and 4 to 6% for the fiscal year 2020-21 overall. This represents the most significant economic decline we have suffered in over 4 decades. It is therefore an imperative that we get our economy back to full productive capacity as quickly as possible. As of tomorrow, we are moving towards a broader opening of our economy. I cannot overemphasize, however, that we need to do this in a safe way. We must continue to protect lives while securing our livelihoods.
In what would become the new norm under the Disaster Risk Management Enforcement Measures Order 2020, we saw curfews being implemented and protocols for the wearing of masks and social distancing, among other measures, as a means of slowing the spread of COVID-19 in Jamaica.
The day to next day, night to early morning curfews will continue in place starting 9 p.m. tonight to 5 a.m. tomorrow morning, day to day, until 5 a.m. on the morning of June 14th, 2020. In the night time of June 14th, the curfew will begin 10 p.m. through to 5 a.m. the following morning, day to day, until 5 a.m. on the morning of June 30th, 2020. Licensed public passenger transport, state or privately operated, are allowed 1 hour after the end of the curfew, that is between 9 p.m. and 10 p.m. until June 14th, 2020, and between 10 p.m. and 11 p.m. thereafter until June 30, 2020, to travel home from their last passenger drop-off, and 1 hour before the beginning of the curfew, that would be between 4 a.m. and 5 a.m. until June 30, 2020, to travel to their first passenger pickup. No passenger must be transported in their vehicles during the additional 1 hour period allowed for transport operators to travel to and from their homes. We have not specified opening or closing hours for businesses other than the general limits on the curfew hours. We encourage businesses and employees to optimize arrangements to increase productive use of time and safe travel. In terms of markets and vending, these orders are extended to June 30, 2020. Operating hours for markets, vending in public arcades and public transportation centers will remain. These hours are Mondays to Saturdays, 6 a.m. to 6 p.m., and closed on Sundays. Orders in relation to barbershops and hair salons extended. We are going to extend these orders to June 30, 2020. Restrictions relating to barbershops and hair salons remain. That is, no more than 10 persons are to be in any one area, and no more than 2 of those persons must be clients waiting to be served. The business process outsourcing orders will be extended to June 30, 2020. BPOs will operate in accordance, subject to certification and operating protocols as agreed in consultation with the sector. These will be detailed in the order, and as stated previously, I've asked Minister Vaz to have direct oversight for this area. The wearing of masks, this will be extended to June 30th, 2020. Now, once you leave your home, you must wear a mask fitted to cover your nose and mouth. I know it is uncomfortable and I have challenges too with it, but it is important to wear the mask and wear them properly. If you are caring for someone at home who has the virus or who has flu-like symptoms or respiratory symptoms, you must wear a mask even at home. And if you are going to seek medical attention, you must wear a mask on your way to and at the facility.
What we're doing today, myself and the team from SERA, the health promotion team, is basically moving around in Halfway Tree Square, looking to see persons who are not wearing masks, providing them with a mask. We're going to give out probably 2,000 or 3,000 masks this morning, and basically promoting the message that wearing masks in public spaces, practicing social distancing, hand sanitization, all of this represents the new norm in the fight against COVID-19. As you know, the Prime Minister announced yesterday that effective today, June 1, there will be the work from home order would have expired. What we anticipate, therefore, is that more persons will be coming out to work, to go to the physical space called work, and as a consequence, more will be taking public transport, more will be moving from one place to the next. There's going to be more congregating of persons, and the possibility of the virus spreading is going to become increased. And so what we want is a messaging to the public to say, please remember that part of the approach to reducing the risk of COVID-19 is to wear a mask when you're in public spaces. And we thought Halfway Tree Square was a good place to kick this off. And indeed, the regional health authorities across the country have been asked to go into all the main town squares to promote this concept. This is just a part of the overall public education program, because you're going to see this on TV, you're going to see it on social media, but generally speaking, the messaging to Jamaicans is to wear your mask when you're in public spaces.
Now, following the closure of schools in June, we saw the reopening of schools after weeks of being closed due to COVID-19 restrictions. Many students were seen readjusting to the new normal. However, this only lasted temporarily.
Thousands of high school students across Jamaica returned to school today as they prepare for their upcoming CAPE and CSEC examinations come July. Our news team visited the Herbert Morrison Technical High School in Montego Bay, St. James earlier today to witness some of the changes that were instituted. Principal Paul Adams outlined procedures that have been implemented at the entrance of the school to ensure proper sanitization practices by students and staff.
So the students coming this morning, first of all, they will be met at the gate and directed to the reception area on the outside. The nurse will be there, set up. Temperature checks will be done. Then they will be sent to what we call the devotion site, but there will be no devotion. They will get instructions there. The notices are posted, and it will guide them towards the rooms that they are supposed to occupy. The teachers are ready. It's the first day. We have never operated like this before, but we are teachers, we are educators, and we intend to make sure that we do our best to protect the health, wellness, and education of the children. We do not intend for 1 second to go outside of the boundaries of the Ministry of Health and Wellness and the Ministry of Education and the Prime Minister's declaration. And we must be true and faithful to our parents, our students, and our stakeholders.
Mr. Abrahams further outlined additional protocols that are put in place to safeguard all staff and students.
We have distributed gloves and masks to our relevant ancillary and selected administrative staff personnel. We have communicated to the students and parents individually and through the printed press. We have installed our sanitizers. We have installed additional washing fountains for students to use. We have indicated to them that they should take their own mask. We have additional masks here that they can get if they need. We thought of producing masks, but we always believe that the Bureau standard must have the final say in whatever is placed on the human body. So for the students who are needy, we will use money from our student support program to give them to purchase masks if they so desire.
Mr. Adams says an assessment will be made to ensure that all safety protocols put in place are adequate and, if needs be, to put additional safety protocols in place.
What is happening now, what happens for the next 4 weeks, will guide us within the examination period, if there's anything to adjust and to correct, and will also help us to guide us for September 2020, depending on the conditions under which we'll have to operate. But we are prepared to make the necessary adjustment, take necessary steps in order for the students to be comfortable and satisfied. We have tablets in store for students who may need tablets. We have made provision for students who may not want to turn up because of health-related issues or other concerns. For parents who may not want to send in their students, we are making arrangements we'll know today, and those students will be dealt with as per telecommunication, teaching and learning, as we are doing now, because we understand persons' conditions and persons' situation. Maybe there's a fear factor out there. We haven't felt it yet here at Herbert Morrison, but we are prepared for whatever the situation is. Let me use the opportunity to inform the students that we are prepared for them. They must feel comfortable. We'll do whatever within our powers with the limited resources we have. And as usual, we'll make sure that the environment in which they are educated, and for the teachers, the environment in which they are responsible to educate the children in, we'll make it as comfortable as possible.
Herbert Morrison sixth former and Montego Bay Junior Mayor Tajana Taylor and head boy A.J. Richards both urge students to ensure they follow the safety protocols as they prepare for their upcoming exams.
And as you see here this morning, Herbert Morrison Technical High School has done as much as it possibly can to ensure that we are conforming to the protocols set up by the government. As you can see, we are maintaining social distancing. I just want to say thank you to the Ministry of Education and to the National Secondary Students Council for advocating for youth and allowing us to be here today for the next couple of weeks so that we can get prepared for exams.
So during COVID-19, there are certain things that we have to put in place. There are certain things that we have to remember to do. As students, we have to remember to study for exams, because we still have 60 exams to do. Today is a day that is unprecedented. We've never seen this before. And so we have to put down some serious ground rules to ensure that the regulations put in place by the government are upheld and followed to the T. All right, so, today is a good day. It's good to be back at school.
In the meantime, the Jamaica Teachers Association President Owen Speed encouraged students and teachers to wear the protective gears and stick to the health guidelines.
As President of the Jamaica Teachers Association, there's nothing to celebrate about our members and our students going back out there in the system at this time in the middle of a pandemic, and especially that we are seeing an increase in the number of COVID cases. But at this time, we'd like to encourage our members and the students who are going to be getting back out there to understand that self-preservation is going to be of utmost importance at this time. And what I would like to say to them is that it is a must that they wear the protective gear and that they stick to the health guidelines, which will be coming to them and maybe should have come to them already from the Ministry of Health. And we need to ensure that our teachers understand the importance of protecting themselves. At a time like this, we need to ensure that our students understand that there's need for them to protect themselves against this dreaded virus. It is indeed a deadly virus, and we cannot afford to let our guards down at this time. So our teachers, our students, our parents, they all need to know this is where we are at, unfortunately. But I believe that even though we are getting back out there prematurely, we need to make sure we take the necessary precautions to keep ourselves safe.
Mr. Speed also said that even though many of the teachers are not pleased that they are returning to school prematurely, they must do what is necessary to safeguard them from COVID-19.
Many of our members don't feel comfortable that they are being used as guinea pigs. But, we are at the stage that we are at. It is forced upon us. We are not very pleased that we are going out there prematurely. But at the same time, I must say to our government that if they are considering to go with the shift system, I think it will be a retrograde step because we are trying to move away from the shift system. It is dangerous to some of our children who may have to travel in the nights to get back home, depending on the time that they are let out from school. Indeed, what I'd like to see our government do is to look at increasing the bandwidth across the island, the internet connectivity. And if they do that, then it will put us in a better position to reach our children and to engage in the virtual teaching and learning process. And that is where we need to go instead of a government taking the easier route to go with a shift system, something that we are trying our very best. And we know the disadvantages of a shift system. So I think we should be trying to move away from that and to accelerate the procurement of devices for our teachers and for our children, the procurement as well as delivery of those devices to our teachers and children. The better thing for us to do as a people and as a government is to be seeking to find more companies that are interested in providing internet services to our people.
Reporting for Mello TV News, I am Khalid May.
Come September, all schools held online classes only. Now, in the midst of the COVID-19 pandemic, the death of Jodianne Ferron sparked national outrage after she was reportedly denied timely care and supervision, dying after being transferred between 3 hospitals while in labor and reportedly showing symptoms of COVID-19. Test results later showed that she did not have the coronavirus, with an autopsy report showing that she died of heart failure. Director of Public Prosecutions, DPP Paula Llewellyn, later ruled that there was no material to establish the negligence or incompetence of any doctor or any other person. The family hired attorney-at-law Isette Buchanan along with an independent pathologist.
Isette Buchanan, the lawyer representing the family of Jodianne Ferron, says the autopsy report released to the family shows that the young mother died from complications of the heart.
The family of the late Miss Jodianne Ferron is now in receipt of the post-mortem examination report. And the report in essence has confirmed what the medical representative, Dr. Ford, has stated previously in the media, that she died from complications of the heart. Miss Ferron was unfortunately found slumped over in the ICU unit of the University Hospital of the West Indies. And the family certainly saddened to learn that she was unsupervised, as stated before, and that no one came to her assistance for an unknown duration of time before discovering her on the floor. Certainly, the family awaits what the decision of the coroner's court, as well as any direction from the DPP in this matter. And I await further instructions from the family, certainly as to the next steps.
Our news team visited Ferron's mother, Portia Green Horton, who expressed that as a mother, it is really hard to process what her daughter had went through.
It shouldn't have taken so long, given the fact that Dr. Ford, my independent observer at the time of the autopsy, had already stated the obvious, which is what they had concluded in the present file that they presented us with. While we were having the discussion, I knew I just basically blocked out because it's just very traumatic, and so I have not been through the whole thing. And of course, my daughter Shanice, she has been through it, but she's still fair to tell me some of the stuff because as the mother, it's very hard to really process and to process all that she went through, So sometimes I feel as if I don't know if I want to know, but I will have to, but I can't get the guts to do it right now. It's very difficult.
Mrs. Greenhoughton also said that many things regarding her daughter's death angers her.
Why is it she was found in a slouched position on the floor of an ICU unit? That really bothers me, where you have camera monitoring that particular area. Because of the whole COVID situation and how the doctors and nurses fear COVID, I personally felt from the initial stage that they may have seen her got up out the bed, but because of fear of touching her, because remember, she just gave birth, she was bleeding. So many things angers me. But one thing, I wish the nurse would, or somebody would have listened, because I was on the phone, and I briefly spoke to Dr. Golson as well. And I was saying, she doesn't have COVID. She doesn't have COVID. I said, those are not COVID symptoms. She's pregnant. I'm not a doctor. But I could tell them that that's not COVID. Nobody listens. So that really hits home. Like I said, there are several other things, but that right there, because if they had listened, we wouldn't have been here today. I guarantee you that much. I don't have any trust in the system. I have to trust God. With what I've seen and what the family has been through with the whole ordeal, I don't know if I trust the system, but I trust God.
Reporting for Mello TV News, I am Kayleen May.
We end this evening's Year in Review with the story of University of the West Indies UWI student Jasmine Dean, who went missing on February 27 and was last seen in Papine Square. During one of the searches for Jasmine, we caught up with the Jamaica Constabulary Force JCF and some residents who were conducting the search behind the Donald Quarry High School in Harborview, following leads reporting that she was buried in the vicinity. Let's take a look at that story once again.
We hear some argument like, she there somewhere around the back here, like them bury her, so we come and we are search to see if we can find anything like that. Because sometimes it be a false news, until we come up with something. But the whole thing still, I have to search everywhere. Anything me hear, I have to try and move at it. Because boy, that one, it's puzzling to me. I know that, this puzzle this. How long I search? That 2 months I searching, and them have 2 months, I say. The 2 months them without belonging them. We should have get her already. But, right now, I just put everything in the hands of God because I can't beat the law. The law have it to deal with, so it's like, I just wait for them to see what we can come up with. Because, boy, I tell the truth, this thing for me, I tell them, yo, I don't know how I live with this. I can't sleep, brother, I can't sleep when night come down. Come like at the worst time, and then you wake up in the morning. You don't know what to do again because you don't see how she don't come out. You know what I mean? Last. I just have God give me the strength to say if I can continue and find her. Because I not stop till I find her still now.
On Father's Day, we also visited Jasmine Dean's father, Lloyd Dean, who expressed that the days were empty with no meaningful meals or sleep ever since his beloved daughter Jasmine vanished.
It was not a normal Father's Day yesterday for Lloyd Dean, father of missing Jasmine Dean, who was last seen in the Papine area in St. Andrew on February 27, who expressed that he can't fully celebrate the day without knowing the whereabouts of his daughter.
Well, I'm tell you the truth, family. Come like me no see how me have a Father's Day, because I have my picnic. I have the rest of the youth them, yes, and the youth them make me feel good, as a father, same way, but me want my youth, because me can't see Father's Day without that one. Me can imagine when time you know there on it's the way me feel it, big man. I feel it way in my heart. You know why? Because me walk with her every day, you know, everywhere she go, you know. Me know if she bump, if me and I walk and me not tell her, I say, Maya, step up. She bump her foot, or she step up late, she begs with me, you know. Say, Daddy, you know, I mean, I say, Maya, boy, I mean, I tell you, lift up, but by the time if you say lift up your foot, you done bounce your foot already. So me just imagine how she live without me, because she there somewhere, and she not have good people around her, like I take care of her. I suffer, she suffer.
While suspects have been charged in relation to Jasmine Dean's disappearance, she is yet to be found, which is at the heart of the father's disappointment.
Boy, the police look like more time them have too much thing to do. The one police or the two, we would have really interested in it. Them have too much thing to do. Them can't manage this. Because we are search for somebody and we are program something. You know, come and fight. Because the moment you come and fight, it shift you up. You see me? We are chat the thing. We are follow up the thing. The phone and the card. Right? We find the two person them. Right? Then from the law, hold on upon them two man. Everything cramp this, you know. Because we can't get to track nothing again. You listen to me I say? We can't get to find nothing more. Because them have them two man they lock down. I better them in Lego them two man there. I better them never all them would have find my daughter. So when the policeman they do a there. You see how fast them catch a man. See how fast them find the man. Because I saw when time you're poor, nobody no look upon you, man. See me? But it's only the poor come out to be the best.
The heartbroken dad also said that he still has faith that Jasmine is alive and is asking anyone with information on her whereabouts to contact the nearest police station.
Told me to go on. Someone like a people pitting them a look. Liquor pitting them a look to live with. Most of the man them nowadays. And if I have to catch a pitney and carry I go live with him with them will do that. You know? Because if he's somebody that take her for him girlfriend. Or if it's a sodomite, she want her for herself. But I don't think the little girl did. She did somewhere, man. I don't know if them gone away with her or what, but I know she did somewhere.
Reporting from Mello TV News, I'm Killeen May.
This concludes part 1 in a 2-part series. Join us next time for part 2 of our Mello TV Evening News at 8 Year in Review as we review the 2020 general election, the deaths of Shahini Robinson and DK Duncan, and the country closing the year with over 12,000 cases of COVID-19 and over 300 deaths. I'm Shelley Hill. Happy New Year and thanks for watching.